How to start a home care agency in Arizona. Are you thinking about opening a home care business in Arizona? Maybe you want more flexibility, more income, or the chance to make a real impact caring for seniors and adults who want to stay safely at home. The great news is Arizona is one of the easiest states to start a traditional non-medical home care agency because there is no state licensing requirement for traditional non-medical services. But ease does not mean skipping important steps. Today, I'm walking you through everything you need to know to launch your Arizona home care business the right way. Let's get into it. What is a non-medical home care business? A non-medical home care business is a service-based business that provides assistance with daily living activities for individuals who need support to remain safely in their homes without providing skilled medical or clinical care. The primary objective of non-medical home care is to support independence, safety, and quality of life for clients who may be elderly, disabled, chronically ill, or recovering from an illness or hospitalization but do not require licensed medical treatment. Unlike skilled home health, traditional non-medical home care in Arizona does not require an agency license from the Department of Health Services. However, even without licensure, Arizona agencies must still meet business, legal, and caregiver compliance standards, and if you plan to work with Arizona Medicaid, you must meet additional requirements. Now let's look at the type of services offered while operating a traditional non-medical home care agency in Arizona. Typical services provided include personal care services such as assistance with bathing, grooming, and hygiene, dressing and undressing, toileting and incontinence care, mobility assistance and transfers, feeding assistance, excludes tube feeding, companion and support services such as companionship and supervision, meal preparation and light cooking, light housekeeping and laundry, medication reminders, excludes administration, transportation to appointments, grocery shopping and errands, safety monitoring, and fall prevention. Non-medical home care does not provide skilled or clinical services such as wound care, injections or IV therapy, medication administration, physical, occupational, or speech therapy. These services fall under home health, medical care, which requires licensed clinicians and typically Medicare or insurance certification. Can a non-medical home care agency use a nurse in Arizona? While Arizona does not require non-medical home care agencies to employ a nurse or other licensed healthcare professionals, it recognizes that some non-medical home care providers choose to do so. In these cases, registered nurses, licensed practical nurses, or other licensed professionals may be utilized to support non-skilled functions such as client intakes, care evaluations, case openings, staff training and supervision, medication compliance support, wellness check-ins, and other non-clinical activities. When limited to these non-skilled functions and not involving skilled medical care, these activities are considered within the scope of non-medical home care services in Arizona. Why start a home care business in Arizona? 1. No state licensing required for non-medical home care. Arizona does not require a home care license for traditional non-medical services. 2. High demand for senior care. Arizona has one of the fastest growing senior populations in the country, and demand is rising every year, and the market still isn't saturated. 3. Strong private pay market. Arizona has a high percentage of retirees, snowbirds, older adults with pensions and retirement income, and families willing to pay privately for quality care. 4. Quick startup and low barriers to entry. You can open your agency much faster than in restrictive states. Most people can launch within 30 to 60 days. 5. Opportunity to grow into Medicaid or government contracts. Once established, you can expand into Medicaid services, contracting with Arizona Long-Term Care System, VA community care, home and community-based services. 6. Large pool of caregivers and support staff. Arizona has strong caregiver training programs and large CNA and caregiver workforce. This makes staffing more manageable compared to many other states. 7. High profit potential. Due to low regulatory burden and strong private pay demand, Arizona home care agencies often earn great profit margins, depending on operations. 8. Perfect for new entrepreneurs. Arizona is ideal for beginners because no clinical license needed, No home health medical supervision required, easier compliance, less paperwork, lower liability risk, lower overhead. To start a home care business in Arizona, you will need a Secretary of State formation, a Statement of Information, an Employer Identification Number, EIN, a state tax ID, a National Provider Identification Number for Medicaid purposes, a tangible address, a state tax permit from the Secretary of State's office. Next, let's walk through the steps and requirements for opening a home care agency in Arizona. Even though the state doesn't require a home care license, you still need to set up your business structure, register your name, and meet all state and federal requirements. Here's exactly how to do that. Step 1. Plan your business. Define your services, choose your target audience, set your pricing structure, research local competition and demand in your area. Step 2. Choose a business name. Your business name must be distinguishable from existing Arizona business names, not imply you provide medical or skilled services if you are non-medical. This is critical to avoid scope of practice and misrepresentation issues. If you have plans of expanding into skilled care in the future, pick a name that allows for this growth. Before you commit to a name, search the Arizona Corporation Commission, ACC, business name database to confirm availability and that there are no identical or confusingly similar names. Even if the name is available in Arizona, search the USPTO trademark database as well and do a general Google search to help avoid trademark infringement and branding conflicts later. Step 3, choose a business structure. An LLC is recommended due to its flexibility and liability protection. Other choices include sole proprietorship, partnership, or corporation. Step 4, register with the Arizona Corporation Commission. Here you will file your LLC articles of organization and pay the state filing fee. Step 5, get an EIN. Next, you'll get your EIN from the IRS. It's free and required for banking, payroll, and taxes. Step 6, register for Arizona taxes if required. If you hire employees, you'll register for tax withholding through the Arizona Department of Revenue. Step 7, open a business bank account. Never mix personal and business finances. This keeps you audit-proof and professional. Step 8, home-based office versus commercial office. In Arizona, non-medical home care agencies are not required to have a commercial office. Many agencies legally operate from a home-based office as long as they have a physical address, proper business registration, and meet local city or county requirements. Ensure that there are no zoning or HOA restrictions. That said, choosing a commercial office space can be a strategic advantage. A commercial office helps establish credibility and professionalism, especially when working with referral sources, long-term care insurers, VA programs, or families who want a physical location they can visit. It also supports growth and scalability as it allows for caregiver orientations, in-person interviews, staff training, record storage, and team meetings. A dedicated office space also improves privacy and record security. Step 9, get insurance, general liability, professional liability, workers' compensation if hiring, bonding, especially if caregivers handle money or go into homes, cyber liability for client records, and commercial auto insurance, especially if transporting clients. Step 10, set up your operations guidelines. You may not need a license, but you absolutely need solid documentation to run legally and professionally. The operational guidelines ensure that there are clear lines of authority, responsibility, and accountability, and define how your agency operates on a day-to-day basis, ensuring consistency, safety, and accountability across your entire team. Core documents you need: client service agreement, HIPAA-compliant privacy policy, emergency and disaster plan, caregiver handbook, employee contractor agreements, incident report forms, timekeeping and visit logs, infection control policies, abuse, neglect and exploitation policy, complaint and grievance procedure, care plan templates, and assessment forms. While not required, a home care software is highly recommended. It helps manage scheduling, payroll, invoicing, documentation, and secure file storage, making it easier to stay organized, professional, and ready to scale. Step 11, background checks and caregiver requirements. Hire compassionate caregivers and create an onboarding and training plan. In Arizona, caregivers working for a home care agency must complete a Level 1 fingerprint clearance card. This is mandatory. Other recommended requirements: CPR first aid, TB screening, valid driver's license if providing transportation, caregiver training, abuse, neglect prevention training, infection control and universal precautions, and dementia care training. Step 12. Home care assessment and care plan. Even without licensure, you must perform a proper assessment before starting care. Create a detailed care plan with scheduled tasks and caregiver instructions. Step 13. Staffing your agency. Decide whether you'll hire employees or use independent contractors. Your caregivers must be trained in client safety, transfers, infection control, fall prevention, documentation, abuse and neglect reporting, and client rights. Check the Industrial Commission of Arizona website periodically to ensure that you are following the minimum wage rules and regulations. Step 14. Marketing your home care agency. Design your logo, build a professional website with service info, contact form, and testimonials. Set up a Google business profile and get Google reviews and social media pages. Network with hospitals, nursing homes, physicians, and discharge planners, senior centers and adult day programs, assisted living facilities and independent living facilities, hospice agencies, pharmacies, elder law attorneys, churches and community groups, etc. Order business cards, brochures, t-shirts, pens, magnets, etc. Don't underestimate word of mouth. Provide good service and your clients will market for you. Ask happy clients for reviews and referrals. In this business, trust is everything. Step 15. Join Arizona Home Care Associations. These associations help tremendously with credibility, referrals, and ongoing training. 1. Arizona In-Home Care Association. 2. Arizona Association for Home Care. 3. Home Care Association of America, Arizona Chapter. Step 16. Stay compliant and organized. Track caregiver hours and client visits. Maintain detailed client files and care plans. Keep insurance and business licenses up to date. Stay educated on elder care laws and best practices. Step 17. Want to accept Medicaid waiver clients? If you want to serve Medicaid clients, you must enroll with Arizona Healthcare Cost Containment System, AHCCCS. This is Arizona's Medicaid agency. AHCCCS administers the Medicaid program for the state of Arizona. You must meet compliance standards, fingerprint card requirements, policies and QA plan, staff training, insurance requirements, billing capability. Step 18. Arizona Home Care Disclosure Law. In Arizona, even though non-medical home care agencies are not state licensed, state law still requires annual written disclosures to every client. Agencies must disclose whether background checks are completed on caregivers who is responsible for day-to-day operations, what training staff receive, including CPR or first aid, what services are provided, how much they cost, and how service agreements can be terminated. Failure to provide these disclosures is a Class 3 misdemeanor, and ongoing violations can result in daily penalties. You are now ready to launch. Now you can start accepting clients, deliver excellent care, ask for reviews and referrals, monitor quality, and adjust operations as you grow. Starting a home care agency is a rewarding path. With the right foundation, structure, policies, and marketing, it can grow into a thriving, meaningful business that changes lives every day. Resources. Here are the key resources you should know to help save you time and make the process easy and practical. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you, and feel free to share this with anyone who might find it useful. See you in the next video.